Well, this is a story for everyone out there. This year, another 1 million cases of skin cancer will be detected. And I know everybody thinks, first of all, oh, it's a small thing. Well, 80% of those will be basal cell carcinoma, which is slow growing, but very varied in appearance. And so it's often difficult to detect. And if it's not detected and treated, it can be life-threatening. And no one knows better than our next guest, who is Michelle Charlesworth, an anchor and reporter at WABC TV here in New York. How is this? She's out on a story, and her cameraman asks the doctor, it's a medical story, to take a look at him. And the doctor turns his magnifying glass on her, and it's something that may have saved her life. And a little bit of a warning, some of what you're about to see is pretty graphic.
This little thing right there is actually, I thought it was a pore or something. But it turns out it was it's cancer.
That was back in February. The problem was my doctors wouldn't know how much cancer was in there until the skin was removed and tested. So this was not only a medical problem, it was also cosmetic. Where did it come from? Well, one explanation was every summer as a kid, I was in the sun. This was at the prom, and this was just last summer before I had any idea I had a problem. I always thought the biggest risk was premature aging. I never thought the sun would lead to surgery, much less 27 stitches. We were shooting a story with Dr. Bruce Katz on something else when a photographer with me asked about his face.
He got his magnifying glass out and said, I wanted to ask you about that. And thank God.
A biopsy came back 2 days later, basal cell carcinoma. 2 weeks and 2 professional opinions later, it was time.
You know, I woke up this morning, I did not know what I was doing.
Are you worried about what you're gonna look like afterwards?
Terrified. Yeah. Because what they've told me is they have to cut it out, and then they might have to go up here and get more and flip it down. So then I'm thinking it's this big. And I want something like that on my head.
Scared?
Mm-hmm.
We're gonna go around that area with a margin of normal skin.
Right.
And check it under the microscope.
So you're going to take the first cut as like a big circle?
Yeah, we're going to go make a circle, go around it, check that under the microscope.
Okay.
If it's clear, that's the end of your day.
Now, as it turned out, it wasn't, and it would be 2 more hours before all the skin cancer was out. And keep this in mind, the whole time I was awake with only a local anesthetic in my cheek. Dr. Davis uses Mohs surgery, which errs on the side of caution. The smallest possible affected area is cut, dyed, and then frozen for 45 minutes. Then doctors examine where the cancer cells have spread under a microscope. If they have to go back in, clear areas are left alone, and affected areas mean more cutting. This was the first and biggest cut. This was my cancer.
I know I look awful, so I'm like freaked out.
But because he tried to save as much of my face as possible, and it turned out the cancer had spread, Davis had to go in 3 separate times to get everything.
What's the worst? What do you think the worst thing is?
The worst is if it really is noticeable, I think. If it screws up your smile or, you know, if it really changes the way you look.
When every margin around the cancer was finally clear, plastic surgeon Dr. Michael Bruck, who'd been watching every single cut, stepped in.
What I'm hoping we'll be able to do is, since this lies in the fold, is to, in a sense, almost do what you would do in a facelift, but in reverse. Instead of moving the tissues that way, move the tissues this way, and then try and have a final scar that lies in the fold.
The hole in my face was nowhere near my laugh line, so moving it was tough. But look at how it turned out. Dr. Bruck worked for another 3 hours through 3 levels of tissue and 27 stitches to do what I had thought would be impossible. A week after surgery, this is what I looked like when it was time to remove those stitches. Over time, the doctors promised the swelling and the scarring would eventually go away.
And here she is with us this morning, our pal Michelle Charlesworth after the surgery, and our medical correspondent Dr. Nancy Snyderman standing by too. So let me take a look at your face, can I?
Mm-hmm.
This is now 4.5 months
later. 4.5
months.
months.
I don't know if everybody can see a small scar in here, but it's remarkable how well concealed it is.
I'm so lucky I had such a good doctor who was able to, because the scar would have been here to here.
You know, they have to get in there and really dig.
And again, I think the thing we got to say over and over again, you're 31 years old.
Right.
This is not something that people can wait until they're 60 to worry about.
No, I was 30 when they found it. I have olive skin. I don't burn. It didn't look like a mole. I had no idea in the world that it could have been skin cancer.
You said at the top of this you just thought it was a pore that was causing you a little trouble?
Exactly, and I'd gone to facialists and they had messed with it. Probably not a good idea. They didn't know what it was. This doctor knew immediately, and I have to tell everyone, if you have an aberration on your skin, check it out.
Nancy.
Because you don't know what to look for.
So people are afraid to run to the doctor, false alarms, but you're saying go if there's anything,
yeah,
right?
and this
Any
is
question.
one case where I think if you don't go, you pay a bigger price at the end, because these don't stop and they don't go away. They just continue to slowly grow. And if she had waited, it would have been a bigger defect, and then every time these get bigger, it becomes a bigger issue about how to put the skin back together. And a great lesson, skin cancers can happen to young people.
And eventually basal cell carcinoma can go into bone.
Sure.
And it can be life-threatening.
Absolutely. I mean, 95% of these are curable because they, for a long time, sit on the surface of the skin. But if you don't pay attention to them, they can act like any other cancer, and they can eat away at everything that's around them.
So the quick rules are go to the doctor and sunscreen.
And you have to be like the Aussies. They have this phenomenal campaign where they say slip, slap, slop. Slip into something long-sleeved, slap on a hat, and slop on some sunscreen. The sun is fun to be in, but it is not to be abused, and you must be in it with reverence, and that means every day sunscreen on every exposed part of your body.
You change everything you do now?
I wear hats to play tennis, to run, to do just about anything where I'm going to be outside for any extended period of time. Every moisturizer has stuff in it. I've been wearing sunscreen on my face for 10 years. Still got it on my face. That's where the cancer showed up.
15 is the number you
15 is
suggest.
I was wearing
absolute
15.
minimum.
No kidding?
You know, I've been wearing that on my face forever, so.
And if something
You know?
pops up and it doesn't look normal, just go get help. The real saving grace here, if there was anything, is that, with such a beautiful face, if you're ever going to have a basal cell cancer, it was in a spot where at least you can hide it in this fold. But that's a little bit of luck on top of the bad news. And again, gifted surgeons who were aggressive and smart as how they put her back together.
I'm so lucky.
You still notice it every morning when you wake up?
You know what, I don't.
No?
I go out on weekends and I don't wear makeup, and I'm just so lucky I had a great surgeon and that it's fading.
Yeah,
slowly.
it's a nice reminder how lucky you can be
No
sometimes,
kidding.
too.
Yeah.
Thanks, Michelle.
Thank you.
We loved having you here.
Thank you
Thanks,
so
Nancy.
much.
You bet.
We'll be right back.